Okay, let's discuss the bladder channel, the Luo-Connecting vessel system. Pathway, the bladder Luo-Connecting channel separates from the bladder primary channel at bladder 58. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal division run to the interiorly exteriorly paired kidney primary channel. According to some schools of thought, they travel as a transverse bladder Luo connecting vessel to the U1 source point, kidney 3. Solinas et al. Describe a longitudinal division following the pathway of the bladder primary channel, reaching the head and penetrating the nose. While this division is not mentioned in the classics, according to Solinas et al., it becomes evident based on the classic descriptions of the pathologies of the Luo-connecting vessels. Clinical importance, pathology, excess, obstruction of the nasal passages, clear watery nasal discharge, headaches, back pain. Deficiency, nosebleeds, chronic clear nasal discharge, sinusitis. The bladder primary channel begins at the inner canthus of the eye at Guangming, bladder 1, and ascends along the forehead to the vertex to intersect with GB15, DU24, and DU20. From the vertex, a branch descends to the temples in the region above the ear, intersecting the gallbladder channel at the points GB7, GB8, GB9, GB10, GB11, and GB12. From the vertex, another branch enters the brain, meets the governing channel at DU17, then emerges to descend to the nape of the neck where the channel splits into two branches. The first branch descends along the posterior aspect of the neck, intersecting DU14, DU13, then descends alongside the spine, 1.5 tune lateral to the midline to the lumbar region. Penetrates deep into the interior via the paravertebral muscle to connect with the kidneys and link with the bladder. A sub-branch separates in the lumbar region, descends along the sacrum, crosses the buttock, and descends to the popliteal fossa of the knee at bladder 40. The second branch separates at the nape of the neck and descends to the medial border of the scapula and then parallel to the spine, 3 tune lateral to the midline to the gluteal region. Crosses the buttocks to intersect the GB30, then descends along the posterolateral aspect of the thigh to meet with the previous branch of the channel of the popliteal fossa at bladder 40. This descends through the gastrocnemius muscle, emerges posterior to the lateral malleolus at bladder 60, then follows along the fifth metatarsal bone to terminate at bladder 67 at the lateral side of the tip of the fifth toe, where it meets with the kidney channel. Thank you for your attention.
Let's now talk about gallbladder 5, Shen Lu, a point of the eye system. GB5 is located at the junction of the second and third quarter of an imaginary line connecting stomach 8 and GB7. How to find? First, locate the two reference points. Stomach 8, which is 4.5 tune lateral to the midline and 0.5 tune within the anterior hairline at the corner of the forehead, and GB7 in the depression on the level of the apex of the ear within the circumauricular temporal hairline. Then divide the slightly curved line between these 2 points into quarters and locate GB5 at the junction of the upper 2 quarters with the lower 2 quarters. Generally, this point is located on the level of the parietal suture just within the hairline. Needling is 0.3 to 1.5 tune transversely or subcutaneously along the skull in the direction of the occiput or towards the disorder or pain. Actions, indications, expels wind and heat, opens the channel. Special feature, meeting point with the TB, LI, and stomach channels. GB5 subdues liver yang, so it's good for headache, dizziness, blurred vision, extinguishes interior wind for convulsions, lockjaw, aphasia. GB5 is used for interior wind causing convulsions, spasticity, and aphasia. Apart from this, it is an important local point for temporal headaches from liver yang rising. GB5 belongs to the temporal group of points of the eye system, and it is the most important of this group as it is in direct communication with the brain. It should be needled horizontally, that is, at a 15-degree angle towards the back of the head. This is good for one-sided headache extending to the outer canthus, pain of the outer canthus, headache, toothache, pain, swelling, and redness of the skin of the face, nosebleed, incessant turbid nasal discharge, rhinitis, febrile disease with agitation, and fullness and absence of sweating. For one-sided headache, we combine GB5 with GB4 according to 100 symptoms. GB5 is crossing point of GB, TH, stomach, and LI, helpful for dizziness, one-sided headache, cerebral weakness, and congestion. Consider for a lack of determination to see a plan through or for a lack of coordinated movement or speech. Smooth coordination and flow of all faculties of body, mind, and spirit are part of the roles of the liver and gallbladder. As the official for judgment and decisions, immense stress is placed on the gallbladder to facilitate all the timing and transactions within the body, mind, and spirit. Imbalance here may be shown as clumsiness, an inability to negotiate one's environment, inability to grow, develop, and execute a plan, whether for a simple journey or one's life. This point is used for disturbance of movement, lack of coordination, or lack of determination to proceed with one's plan. Without this smooth facilitation, anger, frustration, or resignation may cloud the spirit and thwart the potential of the person. GB5 is close to the motor area of the brain, and this point is useful after wind stroke. This point activates the meridian and can be used when there is cerebral weakness and congestion. GB5 is a crossing point within the Guangming. The stomach is the origin of fluids, and the large intestine absorbs and eliminates fluids. This crossing point is useful for facial swelling with or without redness or heat, toothache, nasal discharge, rhinitis, and nosebleed. Locally, it relieves pain and can be used for toothache and headache, disperses swelling. GB5 expels wind and clears heat, and so can be used for migraine, especially one-sided, deafness, epilepsy, pain in the outer canthus. It is also useful when there is fever with vexation and fullness, that is, agitation and fullness with absence of sweating, and can affect both the Shaoyang and the Guangming meridians. Thank you very much for listening.
Let's now discuss the kidney channel, the Luo-Connecting vessel system. First, let's explore its pathway. The kidney Luo-Connecting channel separates from the kidney primary channel at kidney 4. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches of the San Lu, Fu Lu, Sui Lu within the surrounding tissue. Horizontal division run to the inferiorly exteriorly paired bladder primary channel. According to some schools of thought, they travels as a transverse kidney Luo-Connecting vessel to the Yuan source point bladder 64. A longitudinal division follows the kidney primary channel to REN 17, penetrates the thorax, and reaches the spine in the lumbar region. Clinical importance. In its pathology, if there is excess, it will manifest with retention of urine. In deficiency, there will be pain in the lumbar region. And for counterflow chi, there will be restlessness, anxiety, fear, depression, fullness in the chest, and epigastrium. The connecting channel pathway. The kidney connecting channel starts at kidney 4, from where a branch connects with the bladder channel. A branch runs along the main kidney channel to the perineum and ascends through the lumbar spine. The Luo-Connecting channel separates from the primary at the kidney 4 and connects with bladder 64. A branch follows the kidney channel upward to a point below the perineum, then threads its way through the lumbar vertebrae. Symptoms of the Luo channel excess will be irritability, depression, and uresis. And symptoms of Luo channel deficiency, there will be low back pain. Thank you for your attention.
Let's discuss the pericardium channel Luo-Connecting vessel system. Pathway. The Luo-Connecting pericardium vessel system separates from the pericardium primary channel at its associated Luo-Connecting point, P6. It forms a three-dimensional reticular network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal division run to the interiorly-exteriorly paired triple burner primary channel. According to some schools of thought, they travel a transverse pericardium Luo-Connecting vessel to U1 source point, TB4. A longitudinal division follows the pericardium primary channel along the anterior aspect of the arm, crosses REN 17 on the midline on the level of the fourth intercostal space, penetrates the thorax, and terminates at the pericardium and the heart. Clinical importance, pathology. For excess, there's heart pain, angina pain, thoracic pain. For deficiency, restlessness, irritability. Luo channel separates from the primary channel at P6 on the wrist, connecting with the Sanjiao channel at Sanjiao 4. Another branch spreads out between the two tendons and follows the pericardium channel to the pericardium, after which it connects with the heart. Symptoms of excess, chest pain. Symptoms of deficiency, irritability. The pericardium channel pathways, as well as the status of the pericardium as the protector of the heart, help explain most of the actions and indications of the points of the pericardium channel. This can be summarized as treating disorders of the heart song, such as pain, palpitation, irregular heart rhythm, treating disorders of the spirit, and treating disorders of the chest in general, including disharmony of the lungs. Treating disorders of the upper or middle jaw due to stagnation of the qi of the foot, jaw and liver channel with which the pericardium channel is paired, according to 6-channel theory. Treating disorders of the middle jaw, especially the stomach. Treating disorders of the lateral costal region, the pericardium senior channel disperses over the anterior and posterior ribs. Treating fibral disease, the pericardium belongs to fire and takes the burn of attack by exterior pathogen that might otherwise injure the heart. The points of the pericardium channel, therefore, are important in the treatment of fibral diseases, especially at the nutritive and blood levels and when there is disturbance of consciousness. Treating swelling and pain of the axilla. Thank you for your attention.
The gallbladder Luo-Connecting channel. The gallbladder Luo-Connecting channel separates from the gallbladder primary channel at its Luo-Connecting point, GB37. It forms a three-dimensional reticulate network dividing into multiple branches and sub-branches within the surrounding tissue. Horizontal divisions run to the interiorly-exteriorly paired liver primary channel. According to some schools of thought, they travel as a transverse GB Luo vessel to the Yuan source point, liver 3. A longitudinal division descends to the dorsum of the foot and spreads to the third, fourth, and fifth toes. Clinical importance. Excess condition will manifest as cold sensations in the feet. Deficiency condition will show weakness, weak musculature of the foot, including difficulty in standing, paralysis of the lower extremity. The gallbladder belongs to the wood phase, and its two principal functions are to store and excrete bile and to rule courage, decision-making, and judgment. It is by virtue of these functions, as well as the channel pathways that were discussed, that many of the actions and indications of the points of the gallbladder channel can be explained. This can be summarized as treating disorders of the eye, especially those due to exterior wind heat or liver and gallbladder channel heat. Treating disorders of the ear, especially those due to exterior wind heat or liver and gallbladder channel heat. Treating headaches, especially one-sided headaches affecting the Shaoyang channel at the temple and side of the head. Treating disorders of the liver. The liver rules the smooth flow of qi, and when this free-flowing function of the liver is impaired, qi will stagnate. At the same time, the liver and gallbladder are entrusted with the ministerial fire, and their stagnant qi readily transforms to fire. If liver fire consumes yin, it may give rise to the pattern of uprising of liver yang, whilst either liver fire or liver yang may generate interior wind, and liver qi stagnation, liver fire, liver yang, and liver wind may all manifest along the course of the gallbladder channel in the head, ears, eyes, chest, breast, and lateral costal region. Treating phloem disorders, scrofula, and nodules. The smooth flow of body fluids is in part dependent on the free flowing of the liver qi, whilst liver fire may condense body fluids into phlegm. Points of the gallbladder channel are indicated for stagnant qi and phlegm, and the consequent swelling and nodulation in the throat, supraclavicular fossa, axilla, and breast, all regions traversed by various pathways of the gallbladder, primary and secondary channels. Clearing damp heat from the gallbladder fu, manifesting as jaundice, pain of the lateral costal region, nausea and vomiting, fever. Clearing pathogenic factors from Shaoyang level, giving rise to alternating chills and fever, bitter taste in the mouth, hypochondriac pain, dryness of the mouth and throat, and nausea and vomiting. Treating disorders of the spirit and ethereal soul. The gallbladder rules judgment, decisiveness, and courage. Its divergent channel enters the heart, and the gallbladder wood is the mother of heart fire. Points of the gallbladder channel are therefore able to treat disorder of the spirit and ethereal soul, or hun, due principally either to gallbladder and liver fire or gallbladder qi deficiency. The girdling vessel only passes through 3 acupuncture points, GB26, GB27, and GB28, whilst its confluent point is GB41. This extraordinary vessel is therefore principally influenced by selecting these gallbladder channel points. The Hui meeting points of the sinews, GB34, and the marrow, GB39, belong to the gallbladder channel, which traverses the entire lateral portion of the leg. Many points of the lower portion of this channel, therefore, are important in the treatment of disorders such as atrophy disorder and painful obstruction. Thank you very much for your attention.
Let's discuss the points of the eye system. DU16, Fang Fu, Palace of Wind. Location on the posterior midline, directly below the external occipital protuberance in the depression between the origins of the trapezius muscle. How to find the external occipital protuberance is a hump-shaped projection on the posterior surface of the occipital bone on the midline and slightly superior to the craniocervical junction. Okay. Locate DU16 in a depression on the posterior midline that can be palpated directly inferior to the protuberance and between the 2 origins of the trapezius muscle. Generally, DU16 is located approximately 1 tune superior to the posterior hairline. GB20 is located on the same level below the occiput in a depression between the origins of the trapezius and sternocleidomastoid muscle. Needling 0.5 to 1 tune slightly oblique in an inferior direction. Bend the patient's head slightly forward when needling. Caution, dangerous point with deep needling. No stimulation. Strictly no needling in a superior direction. Danger of puncturing the cerebellomedullary cistern, also site for suboccipital puncture. The needle should be inserted into the nuchal ligament. According to some authors, moxibustion is contraindicated. Actions, indications, dispel external wind, calms internal wind and the shen, nourishes the sea of marrow, lightens the shen. Special features, meeting point with the yang wei mai, and according to some authors, the yang chao mai. Sea of marrow point, window of heaven point, sun si miao ghost point, used for all disorders which are caused by external or internal wind and which are characterized by sudden onset, changing location and or intensity of disorder, involuntary movement. It extinguishes interior wind, those in opistotonus, aphasia from windstroke hemiplegia. Expels exterior wind in aversion to cold, fever, body aches, occipital stiffness, and headache. It nourishes marrow and benefits the brain in headache, dizziness, tinnitus, blurred vision. It calms the mind and opens the mind's orifices in manic behavior, desire to commit suicide, sadness, and fear. DU16 eliminates both exterior and interior wind. It can therefore be used for exterior attacks of wind, cold, or wind heat, as well as for patterns of interior wind, such as in windstroke, epilepsy, or severe giddiness. Its capacity in eliminating wind in general makes it a very important point to relieve headaches from liver yang rising, liver wind, liver fire, and acute headaches from exterior wind. Its action in treating headaches is also partly due to these points being a point of the eye system which emerges from the brain at DU16 Kung Fu. DU16 is a point of sea of marrow. The marrow fills up the brain and this point can clear the mind and stimulate the brain. Window of the sky, point of sea of marrow, ghost point, crossing point of Dumai, and Yang Wei Mai, linking vessel. This point is effective in treating the patient at the spirit level. It can clear the head and bring perspective to their life and aid the integration of body, mind, and spirit. Helps the patient to hear and see with enhanced clarity as a sea of marrow point in combination with DU15, 19, and 20. DU16 can nourish the brain and the senses. This is a window of the sky point. It is suggested that the practitioner consider treating window points on the CF first before using this point to gauge its response. Wind palace is particular name of the point conveys some of the benevolence of wind, its movement and ability to refresh. It is found here in a precious place, a palace of senses where a branch of Dumai enters the brain. This is a powerful point to reawaken and stimulate the sensory organs and motivate the spirit. All window of heaven points promote the free exchange of qi in the neck bridge area. If there is a blockage of qi in this area, the body, mind, or spirit may be affected, causing symptoms of mental disturbance, problems affecting the sense organs, or disorders of the breath and digestion resulting from rebellious qi. This point might be chosen when someone's spirit regularly becomes deeply discouraged or feels embattled by life. They cannot sustain their spirit or keep motivated on their path. This yang point on the predominantly young Dumai intensifies the freeing and brightening the aspect of any window of the sky. It is a potent point that can illuminate and restore a sense of rooted but expanded hope for a brighter future, as well as opening the window to allow the spirit to be present with a greater sense of connection to heavenly qi. Wind ballast, as well as the benevolent relationship with wind, this area is vulnerable to attack by wind. It is a most useful point to clear pathogenic wind, whether from an internal or external cause. Wind stroke epilepsy colds. A branch of Dumai enters the brain here and brings yang to clear and stimulate the yin of the sea of marrow and the sense organs. The alternative names, root of preoccupation and clear-headedness, indicated the possible use of this point to clear the frustrations of thoughts continually swirling about with no direction of resolution. Kung Fu is one of the ghost points. Its location on the predominantly yang Dumai as this place of entry to the brain with its stimulating effect on the mind and spirit makes it a great point to restore someone to full consciousness and strength. Thank you for your attention.
Let's continue our discussion of the triple burner channel with the triple burner divergent channel. First, let's talk about its pathway. The triple burner divergent channel separates from the triple burner primary channel near triple burner 20. It then ascends to DU20, descends along the posterior aspect of the ear to the neck to triple burner 16 on the posterior border of the sternocleidomastoid muscle, where it connects with the triple burner primary channel and the pericardium primary channel to form one of the 6 Hu confluences. Here it is the pericardium triple burner as the 5th confluence. The triple burner divergent channel further descends to stomach 12 in the supraclavicular fossa, penetrates the thorax, disperses in the pericardium, and reaches the upper, middle, and lower burners. Clinical importance. The triple burner divergent channel strengthens the relationship between the upper, middle, and lower burners. Triple burner points can be used for disorders affecting these areas and organs. The triple burner divergent channel reaches the vertex at DU20. Therefore, triple burner points can be used for headaches, dizziness, and others, but also to raise the yang qi for prolapse, etc. So to recap, the sanjiao or the triple burner divergent channel separates from the primary channel on the head and branches to the vertex, and then descends to the supraclavicular fossa and across the 3 jiao, dispersing in the chest. The sanjiao channel of Han Xiaoyang belongs to the fire phase, is interiorly exteriorly coupled with the pericardium channel, and is paired with the gallbladder channel of Fu Xiaoyang according to 6 channel theory. The sanjiao pericardium relationship is further strengthened by the fact that, first, the sanjiao primary channel connects with the pericardium, and second, the sanjiao Luo-Connecting channel converges with the pericardium channel in the chest. The sanjiao gallbladder relationship is strengthened by the fact that the sanjiao channel connects with the gallbladder at the side of the head and at points gallbladder 1, gallbladder 2 to gallbladder 6, and gallbladder 11, gallbladder 20, and at gallbladder 21 on the top of the shoulder. In addition, it is important to note that, first, the interior pathway of the sanjiao primary channel passes through and links the upper, middle, and lower jiao. Next, the interior pathway of the sanjiao primary channel descends between the breast to REN 17, and then the sanjiao primary channel ascends both posterior and anterior to the ears as well as entering the ear. The sanjiao primary channel ascends to the inferior aspect of the eye, and the primary and senior channels go to the outer cantos of the eye. The sanjiao divergent channel spreads to the vertex. The sanjiao senior channel connects with the root of the tongue, and the sanjiao primary channel ascends through the cheek. Thank you for your attention.
Let's continue discussing the TCM pathology for cough. Coughs may be classified in various ways using fullness and emptiness parameters. So as we can see from the figure, we classify cough according to full and empty. And we also use the exterior and interior parameters. So for full patterns, we differentiate exterior from interior. And exterior would include wind cold, wind heat, wind dryness. And the interior pattern will include damp phlegm, phlegm heat, fire, and phlegm fluids. The empty pattern for cough would involve lung qi deficiency or lung yin deficiency. So for classification of cough according to exterior and interior, under exterior, we have wind cold, wind heat, and wind dryness. And for interior, we subdivide it into full and empty. Under full, we have damp phlegm, phlegm heat, fire, and phlegm fluids. Empty patterns, interior, lung qi deficiency, and lung yin deficiency. So we prefer to classify coughs as acute or chronic because this factor is clinically more significant. When presented with the patient with a cough, the first thing to ascertain is whether the cough is acute or chronic. Once this has been ascertained, one needs to establish whether the cough is external or internal. Acute coughs may be external or internal, but are always of the full type, while chronic coughs are always internal, and they may be either of the full or the empty type. Many of the old classics also stress the classification of cough according to acute and chronic. For example, the Yi Shui Ru Men classifies cough according to acute and chronic, each of them with or without phlegm. If an acute cough manifests with phlegm, it is due to exterior invasion, and the treatment principle is to release the exterior and eliminate the pathogenic factor. If an acute cough manifests without phlegm, it is due to fire, and the treatment principle is to drain fire. The Ming Yi Sha Chu also recommends distinguishing between acute and chronic cough. It says, acute cough may be due to invasion of wind cold, in which case one must scatter the pathogenic factor, to fire, in which case one must drain fire, or to damp heat, in which case one must resolve dampness. Chronic cough may be due to deficiency or to stagnation. In deficiency, one must tonify qi or nourish blood. In stagnation, one must eliminate stagnation. The Source of Miscellaneous Diseases by Shen Chin Ao says, cough should be classified according to acute, chronic, and full empty. In acute cough, the lungs are obstructed by a pathogenic factor. This may be wind, in which case one must release the exterior. Cold, in which case one must scatter. Heat, in which case one must clear. Fire, in which case one must drain. Dampness, in which case one must resolve dampness. Phlegm, in which case one must resolve phlegm. The train of thought and the guideline for interrogation of the patient may be represented with this diagram. So, after classifying whether the cough is acute or chronic, we determine if it's external or internal for acute, okay? And then you need to differentiate between hot and cold. So if it's hot, wind cold, it's wind heat, cold, wind heat, cold. For internal, we have hot, so with phlegm and without phlegm. For if it's chronic, then all we have to do is differentiate whether it is full or empty. So for full, it should be hot or cold. Empty, determine whether it is qi or yin aspect that is deficient. So if it's yin deficiency, you determine if it's with empty heat or without empty heat. As we have seen, most Chinese books place the emphasis on resolving phlegm as a treatment method for cough. It is important to understand that all these books give this recommendation primarily from the perspective of herbal medicine. If we use only acupuncture, our thinking must be somewhat different. Of course, we can resolve phlegm with acupuncture, but it is important to understand that acupuncture's way of achieving this differs from that of herbal medicine. Herbal medicine resolves phlegm with herbal drugs that actually dry up phlegm. Herbs that resolve phlegm are generally pungent and drying, such as Bansha rhizoma, Pinelliae preparatum, and Dananxing rhizoma, Erythematis preparatum. How can acupuncture resolve phlegm? It can do so only by regulating qi, that is, restoring the correct ascending, descending, and entering, exiting of qi in the qi mechanism. It follows, therefore, that when giving acupuncture, we must pay attention to regulating the flow of qi rather than attributing a phlegm-resolving action to specific points, for example, stomach 40. In other words, as acupuncturists, we must think more of qi flow than actions of a particular point. Indeed, how does stomach 40 resolve phlegm? It does so specifically because it subdues rebellious qi in the chest and makes the qi descend. By regulating the ascending-descending of stomach qi, it also affects spleen qi. The regulating of the flow of qi in these two organs results in their transporting and transforming fluids in the correct way, and therefore indirectly resolves phlegm. Thank you very much for listening.